Welcome to Living Whole Life, a collection of our perspectives, travel life, and passion projects. I'm Sarah, travel nurse, board-certified holistic health practitioner, and creator of Living Whole. This is my husband, Kevin, artist, painter, professor, and this is Fitz. This is us, living art, living health, documenting and sharing our life, leisure, and living whole. There's a hashtag trending that says shut down mass, and a lot of conversation revolving around this whole COVID.
What, not allowing people out?
Yeah, like shutting down restaurants, shutting down bars, because people are starting to become a little more outraged that as we go on with our normal daily lives, the spread is going to increase because of the lack of symptoms.
I don't know how I feel about that. I think you just need to limit your number of people you have in a business place. You don't cripple your restaurants and your local. I mean, these people have to, to me, then you put more strain on your grocery stores and things like that. Because where are people getting food? At least you know that you can go out.
I don't think there's a really good answer besides the whole social distancing. But even then, with what's going on in Italy, we're kind of on that track. And that's, I think, in flattening the curve, when we see the kind of the peak onset of all of this, the United States is going to see such a bell curve, like such an intense spike that hospital, like we nationally don't have enough ICU beds and like nursing support. I mean, even interdisciplinary.
Yeah. No, I know that.
I don't know. How are we going to keep ourselves busy through all of this?
I can always be working.
On March 6th, we had rumors in the hospital of a COVID positive patient. By the 16th, we had multiple patients positive and an entire section of the hospital was quarantined. So I just had a weird moment of an incredible amount of gratefulness, and we have to go through this whole check-in process. It's completely blocked off. Have to show your badge during COVID, and just I'm so lucky to be able to do what I do during this time when so many people are, hurting and off work. And even though I'm exposed and stuff, I just had that moment of I'm really grateful to be a nurse. So I'm technically quarantined here at the hospital in my little room when we're not giving patient care. We are doing our social distancing. Nurse, coming! The fact that they have a cat on a leash outside and I want to meet the cat and have a play date with our cat, and
Can't see them.
those people are gonna think I'm filming them. Oh, I'm a mess. Day 50 of quarantine.
Life has become, I just realized, like the movie Rear Window for everyone. Because that's what we're doing. Everyone's doing the same thing.
We're staring out our window.
Looking out what everyone else is doing.
So long story short, they had their cat outside on a leash and I want to take Fitz for a play date, but he would act a fool. Yeah, you'd embarrass me. What are you doing?
Maybe spray a painting.
I'm in the middle of cleaning. I look like a hot mess, but this is what life has become. We could put him on the leash and take him out.
Does he have his harness?
Yeah, I brought his harness.
If you want to do that, yeah.
I'm afraid a dog will get him.
We have him on a leash. How's the dog going to get him? Just around the number.
Are they still out there?
Yeah.
I look like a hot mess. Like, I would be embarrassed to meet myself. I'd be like,
He doesn't know how to act on a leash either, so he's just probably going to roll around on the ground like an idiot.
Oh, it's such a nice harness. Like, I would want to be in this harness. Yeah, I know it's bad. You just are so unhappy and mistreated. We're trying to get you friends. It's not bad.
It's like a little girdle on him.
I feel like I should put pants on though. I'm in my cleaning clothes. Oh. That's not acceptable.
He's not going to.
Bubbies, we gotta go make some friends and practice social distancing. It's impromptu. It is March 20th. I am in the center here that I work at. We are an interventional radiology cardiovascular center, and we have canceled all our elective cases. And so volume is little to nothing because I'm a traveler and liability issues. I can't float. So I am literally sitting here in a bay by myself because as we are quarantined staff with social distancing, each of the nurses here basically have their own bay that we're like hanging out in. So it could be worse, but I do feel like being wasted. I feel like I should be one of the responders that are helping take care of people in New York or wherever as we feel the surge of coronavirus. And yeah, I'm just kind of very torn. I'm on this contract until July 7th, and it is what it is. I think with like packing up and like this whole trying to digest it and to digest the anxiety associated with it, because it's such a sharp turn to what I mentally prepared myself for. It's almost like, how long is this time frame?
We don't know.
I know, but is it going to be 6 months? And even 6 months, it's worth going back home and readjusting.
The ramifications of this alone, even if it cured a week from now, it's not. The ramifications for the art world and in my situation, and really for this area, I'm screwed for a good while. But it's going to take some time to recover and to reevaluate these things. You know, I'm not sure what the classes are going to look like in the fall semester. If there will be classes, you know.
Yeah.
They were already expecting their entire faculty to come back. I don't know if, you know, I don't know. It's just you don't know. And I think that we just need to follow the money right now and save money, and we need to pursue the masters, and we just follow that right now. That's the only concern. And, you know, I agree. I kind of want us to head back away from these center places and get maybe close to home. But again, that money's not there. But it is, and you know,
We're in our safe spot. Okay. We streamline it. We decide either based on the tension at work or July 7th. Like that's what we do. There's a part of this that's, as I'm doing this, is just kind of surreal. Like, this is where we're at.
The last page I wrote anything was the list of all the events and things that I was we're going to and talks.
And that was what, 2 weeks ago?
Yeah, and so I had to just make an insert and it goes like.
I mean, even the nicer things that I'm keeping are only because they're collapsible, but it's even, like I don't know, it's like a weird disconnect. Like, I'm not even gonna be able to use these, but I also don't want to be so reactionary. It's just very strange, like our time frame our plan, like the way I packed, the way everything was, we're going to be up here for at least a year. It's just strange. How many paintings have you basically churned out in the 10 weeks we've been here? We just finished week 11.
So one is the most. This was just something I was playing with.
Yeah, but I really like that. That one's nice.
That was the one, the last. I think I was working on the last time we filmed in the studio.
Then you have the
And
blue
the
ones.
I brought, and the one I'm working on right now. And the other, so yeah, I'm in the middle of things, and I'm still keeping my supplies so I can, continue to work. Or if we have to leave, all this can go in the tote and we can run. Again, another good reason to keep your studio materials at a bare minimum.
Yeah.
Because I don't rely on anything else.
I feel bad still, like, think about the process that you're having to go through just on a small scale. And this is like a just in case I go head to head with the manager over denial of PPE, but 2 years worth of studio items if you were still at RISD, like what the students and everybody have gone through.
And that's been really sad. And that's why, I try to stay in touch with a few of them. I offered, hey, I have a Subaru if, you guys need help moving out. This is the 10-year anniversary for when I would have, graduate. I was looking forward to going to their big, the big thesis exhibit and, the studio business and all that, because it's such an incredible time, and they missed out on all of that. And it's just, that's heartbreaking. And even my scale of studio, just, having to just uproot and leave. But, it's given our, and then some people just don't give a shit. It's like, screw your world.
He doesn't care.
No. Yeah, but it's I'm able to keep it everything, the way we travel, I'm already mobile. So the benefits of being mobile.
Yeah. I just don't think we realized or even thought, none of us think pandemic, but even the way we packed for this was so different than packing for any other travel assignment. This was much more like I packed clothes that I would never pack out of,
Yeah. And I was keeping these paintings around thinking that, I might have, a few of these I brought from before we...
Yeah, we shoved them in the car.
I might have a studio visit or...
Fit.
A studio visit, or I might, show these. And I know that's not happening in the next, probably not over the summer.
But we might get you a baby brother's.
Possibly. Just walk on that painting, you want to.
You know he's going to.
Just walk on it.
Or he's gonna hit it. He's gonna be like, me. You got something to say?
He knows how mobile we are. He's used to it.
Yeah, I don't want to make him nervous though with all the shuffling and the packing. So, regardless, he's gonna kind of get a little like, oh, what's going on, guys? But again, all preemptive packing. I don't know. I don't know what I'm going to do with this whole... We're probably stuck here regardless until July, but I think with the state of things, not like we're retreating back home, but there's
going to be a need everywhere. So
everywhere.
Just go back home to...
Reset, refresh for just a little bit, and then pick and choose where we want to go next. Because I think even our travel, like our mindset, has changed drastically since January because the whole world has changed.
And it's changing daily.
Yeah.
So it could be a totally different story a week from now.
Just kind of hard. Anyway, I'm gonna, I guess, go back in here for a bit. Okay. So this is the scene arriving to work. I have to log into an app for self-attestation for monitoring of symptoms, be cleared before I can hand sanitize in and get this mask to even access the hospital to get upstairs to do my job. So, yeah, fun stuff. As tensions escalated, we were denied PPE for COVID positive and COVID suspect patients. We were also asked to float outside our specialty. But given the circumstances, I tried my best to advocate for staff and for patients. Following the facility's chain of command, we escalated the situation to the CNO and the infectious disease control nurse. So I am reading the new updates from Sylvia. Of course, I'm probably butchering that, but I just had some questions and I wanted to generate some conversation. They came out with a new COVID toolkit, and I've read through this entire thing. It's a 10-page document, and in their precautions, as well as in the key points, it says that this is standard. Where is it? I want to highlight it for you guys. There is no vaccine available to prevent this infection. Infection control measures are the mainstay of prevention. Standard contact and airborne precautions in healthcare. Earlier in the document, it did say airborne as well. I'm just wanting to generate conversation here for all of us practitioners, healthcare providers that are wearing normal masks. Are you being told the same thing? Are you being given N95s for rule out or for COVID pause patients? So I just kind of want to know what you guys think, and if I'm reading this wrong, please tell me. March 26th would seal the deal for the facility deciding to cancel my contract. And this was the day we had our infectious disease control nurse meeting with the manager. And I was told by the ID nurse that coughing was not an aerosolizing mechanism, and that she herself would feel comfortable going upstairs and taking care of COVID positive and COVID suspect patients with just a plain surgical mask. I cited all of the research and the CDC guidelines and the World Health Organization and the New England Journal and all the research that I'd been doing, not only to advocate for our nurses and myself, but to advocate for patients and their protection. And so, yeah, it was probably the most stressful day I've ever had in my career. And I'm a critical care nurse that takes care of patients both in the ICU and that are coming into the cath lab having an active heart attack. And this was a day that I'm very proud of for my professionalism, but also for my advocacy, even though at the end of the day, I would find out later that they decided to cancel my contract because I disagreed with their policy. And my line in the sand was, I will gladly take care of these COVID positive and COVID suspect patients in the ICU if you provide me with an N95. And that was not the case. Late into the night and early March 29th, I would develop COVID symptoms and receive my own personal COVID swab. Oh, bless his heart. I'm awaiting my results for my COVID swab and just feeling still pretty crappy. Still have a cough, still sore throat, fatigued, body aches. Today I found out that the facility canceled my contract due to the conversations I had on the 26th. So we decided to hit the road to home. You can just barely see New York City over there. My heart breaks for them. Driving home, I've never felt such a relief and like it was the right decision and pride, but also there was a sense of what's next, and it would take me several weeks to get acclimated back to home. Oh my gosh. Our house is a wreck, and this is kind of hard to hold. I need like a little book for you. This is better. I hope you don't fall, but maybe not. So today is Friday, April 10th. It's 11:20 in the morning. I have been, if you can tell by this video, like, you know what's going on. There's no need to say that. We have been home 1 week. We drove out of the Boston area last week, 2 days of driving, a 12-hour day and like a 10-hour day. And we are now home in the peace and the quiet and the sanctuary of really our home here in Arkansas. And it's been a long week. It's been a long 2 weeks, which I can't even believe it's been 2 weeks. What happened to me at the hospital, and unfortunately it came to a head for some of the other travel nurses. The hospital I was at for COVID positive and COVID suspect patients, we were not given proper protective equipment. And it wasn't in the case of New York where there was a shortage and they were reusing. This was we have N95s, we have the face shields, we have everything that we need in order to take care of these patients safely, but we were being denied proper protective equipment. Instead, we were being supplied the very simple surgical masks. Those don't protect healthcare workers. They actually protect people around you if you are sick or have flu, but with COVID, it's a lot different. The other part of this story, of this incident with the hospital, was that both the manager, the policy, and the infectious disease nurse that they had handling this would not classify coughing as an aerosolizing action. And this is still 2 weeks ago, where some of the information surrounding COVID has been changing quite a bit. And I brought forth the CDC guidelines. This was when they were saying that N95s were needing to be used with all patients that were COVID positive and COVID suspect, and this hospital was going against those guidelines. And so in my respectful, professional way, I cited all the evidence-based practice and references that I had, that I was doing research on my own, including sources from the New England Journal of Medicine, from the CDC, from the World Health Organization, and from some of the information that was coming out from physicians and research from the regions that were particularly affected at that time, and their standards and what we as healthcare providers, nurses, doctors, respiratory therapists, aides, all of us should be doing in order to protect ourselves. Not only out of advocacy and safety for myself, but that facility, that system also had, within a week's time, over 100 employees test positive for COVID. And at the end of the day, who's going to take care of the patients if we're all sick, or if we're all out on quarantine or whatever? And that was something that I cited, and I drew my line in the sand, per se. And I never refused to take care of patients. I refused to take care of them without the proper protective equipment, which coming out now, we're seeing more information about how it is truly. It's just, we have more information, and it reinforces the advocacy that I was standing for not only myself, but patients, and for my fellow healthcare providers. And so I ended up becoming symptomatic, and I ended up being tested for COVID. I remained symptomatic for probably 3 days after I got my results, which thank goodness they were negative. But I questioned the testing. I can explain a lot of my symptoms. I can explain the really bad dry cough and the chest heaviness that I was feeling. But again, I'm going to say that I was negative, and the conversation that I had with them the Thursday before that, so it was like conversation on Thursday, really head-to-head conversation with the manager on Friday, and then Monday I was off, and Saturday, Sunday I started becoming symptomatic and was tested on my day off on Monday. I received my results on Wednesday. I went through all the appropriate calling of their COVID hotline. I was following their policy and procedure to a T because I was still symptomatic. I was out and needed to be out for 24 hours, and needed to be out asymptomatic for 24 hours. So until I wasn't showing symptoms for 24 hours, I was technically out per their policy. And it was really hard to have a negative test and be symptomatic and not be able to work and not be able to take care of patients. As scary as this is, if we're given the proper protective equipment, we can take care of these patients because we have to. I mean, that's why I'm a nurse, is to take care of people. Long story short, because we all know how I tell stories, is that I received my results on Wednesday, and Thursday I was in communication back and forth with my company because I had already made the decision to leave the contract, the next contract. So I was in the last week of my contract for the first assignment, but I had a second one I had agreed to, but because of the, I'm gonna say our inability to meet eye to eye, I was choosing not to start that second contract, but I had Thursday and I had Friday left on the last contract. So we are already packed and pretty much ready to go. I'm just waiting for the negative test and the okay for my company regarding how we were going to proceed with the contracts and whatnot, because they themselves are in the mindset to not supply this hospital with healthcare providers due to the standards being enforced. And so alongside those standards, they were also, I had my own N95, and they were telling staff and healthcare providers that even if you have your own N95, you're not to wear it. So long story short, again, I'm getting off track. They canceled me while I was out on following their policy and procedure. And it was a huge amount of relief, because while all of this is going down behind the scenes with the hospital, and I'm done with this, I was presented the opportunity with a colleague to start and be a partner in a company to provide COVID disinfection for both a U.S. division as well as a division in Puerto Rico, which is a whole nother video itself. But that's currently what I'm doing, is I'm building a company with some individuals to provide COVID relief and COVID disinfection to take care of people on the front lines in a much broader scope, in a much broader sense. We can do a hell of a lot of good. And so that's what I've been working on. My life has changed tremendously in 2 weeks. I went from the mindset of we're going to be in the Northeast for a year or two, and now we're back home, and I'm working on a completely different company, providing hazmat and OSHA standard disinfection for COVID in Puerto Rico and in regions of the United States. So this is kind of incredible, but I had to share a little bit of an update and a little bit of why I'm home and what's going on. So now, not being on the front lines of COVID, the amount of anxiety and relief that I feel is almost with the amount of stress that I was under in a 2-week period, this sense of relief and normalcy, even though the world is not normal at all right now, feels very strange. But I welcome it, and I'm starting to relax and get back in my routine here, and I'm just working.